with some bubbling technique, okay? So two very simple things that you can focus on at the moment, especially when you're really stressed or when you're actually poorly fighting the virus. Well, I'm going to demonstrate that de-arousing breathing technique that we call 7-11. Well, not especially us at Euphoria, but in general, and at our preferred one. Obviously, there are other breathing techniques out there, pranayama for yoga, basically triangular breathing, all sorts of square breathing. Wim Hof as well does another breathing technique. But here we are really about trying to keep our heads on our shoulder and our rational thinking. So a lot of our needs have now been taken away from us with all the information there is to process, all the needs that we were quite good at fulfilling, but now you can't go to work, you're scooped up in your house, all the rest and thing, okay? So just really not super straightforward, a bit counterintuitive. You need to breathe into your tummy and not in your chest, basically, and you need to make your tummy bigger. You need to push your hand with your tummy, and you need to breathe out a bit longer than you breathe in. Breathe in to 7, breathe out to 11, or breathe out to 3.5 and breathe in to 5.5, or breathe in to 2 and breathe out to 4 or 5, okay? I'm not moving my chest at all, like that. Okay, because that's really arousing, that's really bringing you in the flat and fright. This one is bringing you in the rest and digest, and it really opens your mind up, okay? And it really calms you down, de-arouses you, okay? And we can do that seated. I'm going to demonstrate to you lying down now. So the great part here is to maybe you'll be in bed or at one part in the day, I'm sure. And what you want to do, if you're reading your Kindle or whatever, I tend to bend my knees. It really diminishes the tone in my abdominal wall. It's so much easier. And I put one hand on my chest, one hand on my belly. So much easier on your back than seated, okay? And basically it really helps, especially at night when you got all those thoughts running. You might be actually worrying about lots of things. You need to keep your head well screwed on your shoulders. Use your rational mind. There's lots of very simple solutions to those problems and how to meet your amount of control that you've lost, status, your financial security, all the rest, all the things that you've been told to do and all the rest. And it's really easy to actually de-arouse yourself, okay?
Can you do an example of how not to do it with chest breathing?
And the chest breathing. It's always not the best way. You want to be able to really de-arouse yourself, not use the sympathetic, call for the vagal brake. Push your abdominal content up. Control your out breath a bit longer. In 10 minutes of doing that, you should be really nicely relaxed and you can really fall asleep quite easily, or really get a little bit that train of thought and that worry a bit out of your head, basically. Another perk of this technique is to concentrate on counting. Maybe if you want to count 7 and 11 or 4, 9 or whatever, okay? And that's really helping you to focus on something else than the train of thought you were thinking about, okay? So you can really count in your head 1, 2, 3, 4, 5. 1, 2, 3, 4, 5, 6, 7, 8, 9. You might start to hear your tummy gurgle a little bit. It's your vagus nerve kicking in, the peristalsis. So it might be a really good indication as well. Your heart rate is going to slow down. You might feel your heart beating, or you might feel a pulse as you breathe out, and it's going to slow down, right down. And if you focus on the numbers, I'm saying it helps you to really empty your mind and really relax nicely, okay? And at night is best, because that's the time where we don't have anything else to focus on, okay? And it can really help you out. We invite you, of course, to look at the human givens, because that's really our biopsychosocial model of health that we're looking at, and all those innate needs that need to be met and all the resources we've got. But we've spoken about that a lot in all our podcasts, basically, in the last 5-10 months, so we can invite you to look at that as well. So we're gonna demonstrate the wall bubbling, which is that technique to actually oxygenate your lung a bit better. So when you're starting to get poorly, nothing better. Bit of water in a glass, a pint, not too much, just a quarter or a third, some paper straws, nothing better than that. And that's your own ventilator, basically. And, you know, there's lots of advice out there, but that's pretty sound. That's really to empty your lung without triggering the coughing reflex. And you're going to actually use one of the straw to actually produce some bubbles in the water. And that's enabling you to actually control your out breath, not trigger the coughing reflex, and really oxygenate that poorly ventilated part of your lung, which is going to get more and more congested as the illness progresses, okay? The shallower, the least pressure you have to apply to breathe out. So you're going to have to find the proper height in which you do, okay? And it's going to splatter a bit everywhere. If you cough, you might want to maybe get the whole thing not too full as well. And if you're in bed, you might want to prop yourself up, okay? But that's a really great way to focus on. You're in bed, hydrate, get some paracetamol into you, and just do some bubbling for hours on end anyway, okay? And it will maybe decrease a little bit how much you cough, and in the meantime, it will keep your lung really nicely oxygenated. It's not about your lung, it's about you and your blood stream. You cough a lot, it's super tiring. If you cough for 6 hours, if it's a constant cough, you're going to be tired and knackered, okay? And the more congested your lung is, the least it's actually being oxygenated. The least it's oxygenated, the more tired you're going to be, because if your partial pressure and oxygen in your blood plummets and goes below 90%, you're going to be knackered, okay? And that's when you're going to be rushed into hospital, okay? So you want to do that bubbling as much as possible, okay? Here we're really talking about breathing into your chest, okay? But I guess you're breathing out longer than you're breathing in. That's the main point, okay? So it's really simple. It's really effective. You can do that. The older you are, the more you should do that, because the more problematic that acute respiratory syndrome is going to be for you, basically, okay? And the main thing is that you're going to get naked much more easily, okay? So if you're asthmatic, if you're a smoker, if you're overweight, if you're anything that cardiovascular problem, whatever, if you're older, anything that put pressure on your breathing, you need to do that a lot. Obviously, when I get the whole COVID, I'll be doing that all day, basically, or not all day, but a few good hours a day. If you do that for 2 or 3 hours a day, you'll really maximizes your chance to not get too depleted in oxygen, basically. And it might sound completely bonkers, but I can tell you that's the best way. It's really proven way of actually going about. It's not a joke, and it's a quite sound advice, I can tell you, okay? So be your own ventilator. Don't actually put even more pressure on the NHS, which is already struggling for people who have underlying health conditions, really, okay? So perfect way of actually keeping your saturation in oxygen pretty high, okay? Thank you for watching those couple of videos, really simple. This should be quite easy for you to really practice. Remember, practice makes perfect. So if you're not used to doing those things, rewatch the videos and practice it. And remember, social distancing is one of the main way of actually not transmitting that virus. And wash your hands after you've done anything, if you've gone out shopping or those kind of things, because you don't want to put your hand on your face when they're dirty, which is what we should do anyway at the best of time, okay? So wash your hands, very important, and keep the social distancing. Really two very simple things alongside the two simple videos I've showed you today, okay? Stay safe and see you on the other side.